Assalamualaikum, Zdravo, Dobro Jutro. I would like to introduce myself. I'm Mulia Pratama, a 5th semester student at the Faculty of Medicine Airlangga University Surabaya, who thank God, Alhamdulillah, now has the opportunity to qualify for the SCOPE-CIMSA IFMSA professional exchange activity as a KKN-International Equalization program in a faraway country on the European continent, specifically in Eastern Europe, in Slovenia. In this activity, I had the opportunity to dive deeper, explore further, and understand better how the health system, patient management, and health technology work, especially in the orthopedic department. During the first week, I was first introduced to the Univerza Mariboru campus environment, especially the medical faculty. Well, apparently, for students, there are several facilities that we can use, such as student coupons to buy food discounts at several restaurants and facilities, also in the form of M-bike. Well, this one is good, namely bicycles that can be used to get around the city, and there are even specific posts to park it every 1 hour before we are allowed to use it again. The next day, I went to UKC Maribor, the second largest hospital in Slovenia. Its position is close to the city center makes it easier for me, other hospital health workers, and patients who need help to access it. The new thing that I found here is that they divide orthopedics and traumatology into 2 different departments. Wow! Where orthopedics focuses more on treating chronic patients with degenerative disease, and traumatology focuses more on acute patients who usually come from accident or trauma. During this week, I found many patients who experienced OA. Now, what is OA? OA, or osteoarthritis, is a chronic inflammation in the joints due to damage to the cartilage. Osteoarthritis is the most common type of arthritis or joint inflammation. This condition causes complaints such as joint pain, stiffness, and swelling. Increasing age is one of the main factors in the occurrence of osteoarthritis. Apart from that, there are several other factors that can increase a person's risk of suffering from osteoarthritis. Such as obesity, injury to a joint, history of osteoarthritis in his family, and even female, especially those who have gone through menopause. Entering the second week, I had the opportunity to be present in the operating room. First, I was directed to wear scrubs that had been provided by UKC Maribor in the doctors and nurses changing room. The procedure is to remove all clothing and jewelry except underwear that's clear, and use a scrub in the form of shirt, pants, surgical cap, mask, and rubber slippers in a size that we can choose and adjust. Wow. And the orthopedic operating room is in number 8 and number 9. So we're all in the same floor with other surgical department. The first thing that I learned straight away was the rules of sterility and how important it is in the operating room. Yes, I did get some warnings from the nurses and the doctors there about what I should and I shouldn't do. But that's what made me learn, and I will continue to always remember it. I discovered many interesting procedures, starting from spinal repositioning, making tendon graft using arthroscopy, replacing hip and knee joints and heads with arthroplasty, and even Morton's neuroma. During spine surgery, I was required to wear a radiology lead apron to prevent radiation from the C-arm X-ray. Just imagine, the doctors and the nurses, they can wear the clothes weighing approximately 2 kilograms for up to 3 until 4 hours of operation time. Wow-wee! In the third and fourth weeks, I had the opportunity to visit several other departments, starting from plastic surgery, cardiovascular, ENT or ear, nose, and throat, and the emergency department with a special subdivision which is traumatology subdivision. I learn so many new things every day, every hour, every minute, and even every unit of time. patient with interesting cases that I had seen in person for the first time in my life, and effective and efficient treatment methods that the doctors uses. In the emergency department, we were given private lessons on how to master suturing using various techniques, both using a needle holder and making knots directly with only our bare hands. Alhamdulillah, I also had the opportunity to provide direct assistance in the ENT department in removing tissue samples which were suspected to be BCC or basal cell carcinoma. Wow! I learned to scrub in and help with procedures on patients who only used local anesthetic. Just imagine, first experience providing assistance to a patient who is still completely conscious. My exchange activity was closed by assisting in a spine screw revision and alignment operation in the orthopedic department. I was given the opportunity to practice and try using a skin stapler. Yes, even though the result was still messy with the spacing of each staple being irregular, the doctor encouraged me to continue practicing and learn because, as we know, the key to becoming a great surgeon is through experience and practicing. Once again, I never get bored saying Alhamdulillah and thank Allah for all this opportunity. This professional exchange activity really brought many lessons for me. In the future, when I arrive in Indonesia, I will use this experience to start some research and publish it for the benefit of the wider community. Well, hi again, I'm Mulia Pratama. Thank you for listening to my short story while studying for 1 month in Slovenia. I hope it can open your horizons and increase your motivation to take other exchange programs abroad and bring greater benefits for a better Indonesia future. Havala.